Kirshner, and I welcome you to this website. Maybe you've been diagnosed with a thyroid problem, or maybe you suspect you have a thyroid problem. Over the next 10 to 15 minutes, I'm going to explain thyroid function, how it works, and our approach to actually handling these particular problems. Now, you need to understand, when we do our lectures, when we do our outside talks, when I ask what does the thyroid do, the knee-jerk reaction usually is that thyroid handles metabolism. Well, that doesn't really give a very clear picture of what the thyroid does. You see, the thyroid does handle metabolism of every single cell in your body. Your brain cells, your kidney cells, your liver cells, your GI cells, your foot cells, every single cell in your body that's metabolically active needs thyroid hormone for it to do what it needs to do. Now, the best way to think of a thyroid is like the thermostat in your house. When you turn the thermostat up, the house gets warmer. When you turn the thermostat down, your house gets colder. But the most important part of that equation is the thermostat by itself does not do anything. You have to actively turn it up or turn it down. The same thing that happens in the body. The body's made up of 70 trillion cells. And these cells, when they want metabolism, they send information to the brain saying, hey, I want metabolism. And then the brain will do what it does to make that cell metabolically active, given which tissue needs to be metabolically active. So maybe you have the hypothyroid symptoms, such as fatigue, can't lose weight, slow wound healing, tired all the time, fatigue, sometimes GI issues, mental fog and fatigue, and the thyroid can cause a lot of other symptoms. Or maybe you have hyperthyroid symptoms, like sweaty palms, jittery, always feel like keyed up, and those are some of the hyperthyroid symptoms. So maybe you have these symptoms, and you have a list of them, and you go to your family physician or your endocrinologist, and you give them this list of numbers, and what they're going to do is they're going to run blood work. And the blood work they usually run to evaluate thyroid function is TSH. Now, going back to when I do my lectures, and I ask, is TSH a thyroid hormone? Some people will say yes, some people will say no, but the truth is TSH is not even a thyroid hormone. Now, I'm going to explain this. See, the way the thyroid works is first your brain, part of your brain called your hypothalamus, releases a hormone called TRH, thyroid releasing hormone. Thyroid releasing hormone will send information to the pituitary, and from the pituitary, that will release a hormone called TSH. That's a hormone that they'll evaluate for thyroid function. So TSH, what TSH does, it's called thyroid stimulating hormone. It tells the thyroid to start creating thyroid hormones. And you got to realize that the thyroid hormone, there's a lot of hormones that the thyroid will actually put out, but the two main ones that we talk about are T4 and T3. T4 and T3. Now, 7% of the thyroid gland, 7% of the hormones that's put out by the thyroid gland is T3. Now, T3 is your active hormone. It's what the cells need to use to become metabolically active. T4, the cell does not use T4 to become metabolically active. It uses T3. So going back to the thyroid gland, 7% is T3, 93% is T4, T4 inactive. So the way T4 gets into the cells is first, T4 will go to the liver and get converted to T3. Some of it will get converted to T3. And then some of it will get sent to the small intestines and other cells in your body, but predominantly sent to the small intestines, and more T4 will be converted to T3. From there, it gets sent to the cells where it starts creating metabolic activity. Now, once you have enough activity in the cells, that's going to send information back to the brain saying, hey, I have enough activity, I'm okay, stop producing thyroid hormone, and then you have a lowering of the TR8, actually lowering of all the hormones, because the cell has enough activity. Does that make sense? Now here's the problem, is you can have a problem with hypothalamus, 1, pituitary, 2, thyroid gland, 3, conversion from liver, 4, conversion from small intestines, 5, not getting into the cells, 6 pathways that can cause thyroid symptoms, and besides number 3, all the rest of them, you could have thyroid symptoms and not even have a thyroid gland problem. Does that make sense? Now here's the other problem, is so we call this, when a person they'll have what we call a primary hypothyroid condition, where there's a problem with the thyroid, or you'll have a problem, what we call secondary thyroid problem, from something else in the body causing that particular problem. Now, if you have what we call primary hypothyroid problems, in the United States, 90% of primary hypothyroid problems is from a condition called Hashimoto's. And what Hashimoto's is, it's an autoimmune attack on the thyroid gland itself. So you're losing, basically what an autoimmune disease is where your body is attacking its own tissue. And on another video, I'll go more into what autoimmune diseases are, because to really understand how to handle this Hashimoto problem, you need to really understand how an autoimmune condition attacks the body. But going back to the thyroid problem, 90% of primary hypothyroid problems are autoimmune. The rest of them, the other 10%, is maybe an iodine deficiency, a tyrosine deficiency, an amino acid deficiency, can be a genetic problem, but something else where the thyroid gland itself is messing up. So so here's the problem is, you have your TSH run, so medically, they're going to work right in this range right over here. They're looking at pattern, maybe, not even 2, but pattern 3 mainly. So they'll run TSH, saying, okay, they'll give you TSH, it's high, they'll put you on meds, it might get to a normal lab range, but they end up still having the same symptoms like you had before. You're not going into your family physician's office to get this number back to normal. What you're going in there for is to get all these symptoms, supposedly all these symptoms, under control, so you're actually feeling happy and healthy again. So our approach is doing the lab work, not just TSH and not just T4, but we look at other lab markers like free T3, free T4, antibodies to the thyroid gland. We'll look at things like T3 uptake, reverse T3. We're trying to look at all the pathways that might be affecting the thyroid gland itself. Hope that helps. On other videos on this site and other sites, there's more information on autoimmune problems and how you handle the autoimmune side, and most importantly, how do you get the health of the cell ramped up? Because the health of the body is determined by the health of the cells in the body. Hope that helps. Thank you.